Hello and welcome to this conversation hosted by the Program on Forced Migration and Health. My name is Yana Mayevskaya, and I am a Senior Program Officer at the Care and Protection of Children Learning Network. We're happy to have with us Mark Canavera, who was a co-director of the CPC Learning Network for nearly 12 years, and Dr. Cassie Landers, who has been a co-director of the CPC for almost 6 years now. As well as Timothy Opobo, who is the Executive Director of the AfriChild Center in Makerere University in Uganda, which has been a partner of the CPC since 2013. CPC was founded in 2005, and what did the fields of child protection and humanitarian settings look like at this time, and what was the gap that the CPC was trying to fill at the time?
Essentially, this was a field that was just emerging within the broader international humanitarian landscape. But what was clear was that there was a lot of work happening that went beyond health or education and that wanted to look at some of the social components of the ways that children were growing up, their situations in families and their relationships to their families, or for some children not being in families, so children outside of household care, or child-headed households, and their exposure to violence, be that deprivation, neglect, or physical, sexual, and emotional violence. These were all fields that had some measurement to them, but that measurement to make sure that programs were operating effectively really needed a boost. And that is how some professors at Columbia came together with practitioners in countries around the world and started learning together. The first countries that the CPC was operating in, Liberia, Uganda, Sri Lanka, and Indonesia, really reflect political realities at the time. So the tsunami in Southeast Asia had affected countries like Indonesia and Sri Lanka that were two of the first CPC partner countries. Sri Lanka also had a civil war underway at the time that did involve the recruitment of quite a number of child soldiers. And Liberia and Uganda were also facing major civil wars at the time. And so this idea of measuring to improve programming and policy emerged. And we still see connections to many of those countries today with that.
At the time, I was very much involved with UNICEF and its main partners and some of the other large organizations. Um, we were at that time really reaching somewhat of a common understanding of what early childhood meant, looking at it not only as survival, but looking at the quality of life for those children who did survive. And while we were making progress in this arena, there was the recognition that if early childhood is such a key developmental phase, what happens to young children in situations of conflict or a natural disaster setting? So, together with several colleagues, we worked on really trying to see what could be the entry points within a humanitarian setting where the impacts were particularly harsh on young children. And so we basically try to work with the child protection system in these settings, as well as with nutrition and health and education, to find entry points where we could build upon the services that were being offered, and working, trying to find the overlap between early childhood development and child protection to identify where we can focus more on the prevention of some of these negative impacts.
In 2012, we set up the Program Learning Group, which was kind of the in-country arm of the CPC. And at the time, we had about 38 organizations that signed up to be part of the Program Learning Group in Uganda. And, it evolved a bit organically. We were able then to, identify our learning priorities at the time. I remember 2012, we then had the first child protection learning event in Uganda. And that was the first time I met Mark, I think, in Uganda, when Mark came down, and we began then to undertake work, especially around child protection, community-based child protection systems. We did a number of studies, and then it picked up from then and moved on to the birthing of the AfriChild Center as part of that process.
Mhm.
Can you share a little bit about the role that CPC and its partner research centers have played in the global child protection community and the academic world, and kind of how these roles have evolved over time?
The whole field of child protection, even in the case of Uganda, was really a new field for many of us actors. Not much investment had really been put in trying to understand the impact of what we were doing. And when we went on to, undertaking the studies on community-based systems at the time, it was quite interesting, to really learn about how these systems had actually worked and how resilient they were. So, the learning was quite telling at the time, and raised quite a lot of interest and also the need really to invest, yes, in the traditional or the informal systems as we were referring to them at the time. So, it was quite interesting for us. Then discussions began and gained traction. We began to do different studies, then developed a training guide, which came out of the CPC for child protection, which is still used today. It's a national child protection training guide to train all the parasocial workers and social workers in Uganda, and I think that's a big contribution as well. And it then even went into the development of a master's course in child protection. A course that was embedded within the curriculum at Makerere University. So that also is really something that came out of this engagement through the CPC. We cannot forget that AfriChild Center that exists now and that has undertaken quite a bit of research and contributed to policy discussions in Uganda is really a brainchild of the CPC and through the CPC engagement.
Thanks, Timothy. And I don't know if, Cassie, you have anything to add, or Mark, in terms of kind of major contributions to the child protection field and any kind of unfinished business.
I really think we need to continue to be very innovative in looking at ways that additional social supports can reach children through, I think primarily health and education are the big ones that are fields that have a lot more contact with children. So I hope that as a field, child protection can open its doors to more collaborations with those sectors.
Yes, the unfinished business is sort of what's on our plate right at the moment, and looking forward, looking a little bit down the road. Something that we have been always doing, but I think the field still needs, is the integration of learning and action, where we link researchers, practitioners, and policymakers together to strengthen and get out some of the information that we already do have, which needs to be more widely disseminated.
Back in the day, we had this model of having these program learning groups, and this program learning group in Uganda has turned into the AfriChild Center, who is now, flourishing with, how many employees do you have now, Timothy? 17?
22.
Yeah, I would love to just hear a little bit about how the partner research centers, kind of the role that they play in this global child protection community, and kind of how these roles have evolved over time.
Over time, the center has been able then, to influence policy. There's been a contribution in shaping the policy environment for children through the evidence that has been generated from the work that we're doing. We now have, we had the Children's Amendment Act in Uganda, for example. Through the AfriChild Center, we have now been able to train about 130 researchers. And we also have a program that trains policymakers and practitioners and utilization of research evidence for decision making. We are now seeing a bigger interest and appreciation for evidence in implementation, having centers in different regions is also now allowing us to think about cross-country studies and learning from the center in Indonesia and in Colombia.
The leadership of passionate people like Timothy, who really wanted to move the research along to improve their governments and their service providers' responses to children's needs, really became the heart of what we do.
Something that I think about often, we always thought of the CPC with the network, sort of the center, but from listening to the partners, the tremendous networks that they have built in their own respective countries. So I think rather than CPC being the network, what we have now is a network of networks where we find overlap between what we're focusing on, but also overlap between our colleagues and future and current researchers. So just a recognition of how much they've grown and brought new practitioners and policymakers into this fold.